It was built as an asylum. We're not asking for it to be reopened by any means. We're asking for it to be repurposed.
More than 2,000 people in Vancouver alone self-identified as being homeless in the 2020 homeless count. 45% of them named mental health issues as being the cause, and 60% said it was due to an addiction. The number of people with mental illness living on Metro Vancouver's streets continues to grow year after year. But could the former psychiatric hospital in Coquitlam be part of a larger solution? We take a look at the provincial government's plans for the land and what it could mean for the future of BC's mental health supports.
We really need to look at the lands at Riverview and look at the facilities at Riverview and really develop a plan to get a critical mass of mental health and addiction services back on the site.
In 2013, BC Housing began consultation on a plan it called Renewing Riverview. 2 years later, a plan for the land was released, envisioning a mental health care district with doctors' offices and transitional housing, a vision which in 2020 still has yet to be completed. As of today, there are 184 people receiving some form of treatment on the grounds. In a co-interview with BC Housing and the Coquitlam First Nation, who work in partnership on the land, they explained just because the institution shut down doesn't mean the site hasn't grown.
Since the hospital's closure in 2012, 5 new facilities were built, and that created 183 new mental health beds. And the most recent of those is the Redfish Healing Center, which is for adults, which Chief Hall mentioned, and that is set to open later next year.
That center is for the most part a transfer of beds, moving the current 94 beds at the Burnaby Center for Mental Health and Addiction and adding just an additional 11 to the system as a whole.
COVID-19 crisis has really raised this again, seeing how limited we are in terms of our housing, how crowded our housing is.
While running for re-election in October, Premier John Horgan promised more frontline support to deal with BC's overdose crisis and said work continues to reopen the long-closed psychiatric hospital. When asked about the delay, BC Housing told City News the provincial election had put things on hold and a larger-scale project would be re-evaluated in the coming months. But there are those who think the entire plan is a wrong move and are against the idea of using the land altogether due to its complicated past.
It's a place with a heavy history, and people have complicated feelings about it. So I'm not sure. that maybe that's not the right place.
Riverview could open under the circumstances of using our best knowledge to care for people.
Mental health and substance use support advocates continue to say help can't come soon enough for our most vulnerable. But historian Megan J. Davies stresses it needs to be the right kind of help. While the asylum is no more, she feels remnants of institutions like Riverview live on in the way treatment is approached even today.
The power structures are still there, the attitudes, the stigma, the discrimination, those things are still there, but it's almost like we get to ignore them because the institution itself has disappeared.
In Coquitlam, Ashley Burr, City News.